Hello and welcome back to Life as Dr. Rute. My name is Rute and I'm a medical doctor. In today's episode, we're addressing some of the commonly asked questions in relation to periods. So we got some of these questions from Google as well as some of the questions that you asked us yourselves. So we'll head straight to the first question. Can you be pregnant and still have a period? The simple answer is no. You cannot be pregnant and still have a period. Now, I know that in very rare circumstances, there's some women who've bled throughout their pregnancy. Now, that doesn't necessarily mean that it was their period. Us doctors recognize any bleeding in pregnancy to be abnormal. So whether that may be a spotting or heavy bleeding or light bleeding, any form of bleeding in pregnancy is recognized as abnormal. And it's really important for you to seek medical advice straight away if you find that you're pregnant and you're bleeding, so that we can establish what could be the cause of bleeding for you. Can you miss a period and not be pregnant? Simplest answer is yes, you can miss a period and not be pregnant, because there are other causes of a missed period. Although that being said, if you do find that you've missed your period, I would highly recommend that you take a pregnancy test. Other causes of a missed period, and it depends what you mean by missed period. Did you miss a month altogether, or was your period late by a few days or so? And all of these can be due to things like stress. It can be due to things like extreme weight loss, extreme weight gain. It can cause stress on your body. It could be things like contraception, maybe things like polycystic ovarian syndrome. Now, it's important if you miss a period that you speak to your healthcare provider about it, so that we can ask you certain questions to establish the cause of the missed period for you. Why are my periods irregular? Now, this touches on a little bit of the things that I've already talked about in the previous question, but one of the things to draw from this question is don't compare yourself to somebody else. The cause of your irregular periods may not necessarily be the cause of someone else's irregular periods. But if you do notice that you have irregular periods, that is also a sign itself to go and speak to a healthcare provider about it, because irregular periods can be due to things like hormonal dysregulations, hormonal imbalance. It can be due to things like contraception, if you're on any contraception. It can also be due to polycystic ovarian syndrome, like I've talked about before, or stress. So it's really important that you seek medical advice. Although it is also recognized that at the beginning of your menstrual periods, when you're first starting off to have periods, and towards the end when you're reaching menopause, you can start to have some irregularities in your periods. But if you notice an irregular bleeding pattern, I would certainly recommend that you speak to your healthcare provider about it. Can you get pregnant during your period? Absolutely yes. You can get pregnant at any point during the menstrual cycle. It's just that there are days in which there's a higher chance of you getting pregnant, especially closer to ovulation. But again, ovulation can happen a little bit early, and so when you think maybe you have a low chance of getting pregnant, it's a low chance, but it doesn't mean it's not a chance at all. Are period cramps as painful as a heart attack? Now, this one I was like, oh my goodness, that sounds really painful. I don't know in what context somebody asked this question, whether they were having really bad pain. And it's really hard to say yes, and you can't say no, because pain is really subjective. So my answer to this, if somebody asked me this, is to say, if your pain is really painful and your periods are stopping you from getting on with your day, going to work, going to school, then that's a sign you need to speak to somebody about it, your healthcare provider, so they can try and give you something to help with the pain, and also at the same time to establish and say, is this pain as a result of just the uterus contracting, or could there be something else causing you to have such significant amount of pain? How do you calculate your menstrual cycle? Now, if you look at the other video, that's got more detail. So if you look at it from the angle of the first day that you have a bleed is day 1, and then the first day that you have a bleed of the next period is day 1. So you count the amount of days it took to get to the next period. And so over time, you should be able to get an idea of the length of your menstrual cycle. The next one. Can you have 2 periods in a month? Absolutely, that depends on the length of your menstrual cycle. So for those people who tend to have shorter menstrual cycles, it's quite common for them in some months to have two periods. Because if, let's say, your period is every 21 days or every 25 days, you might have a period at the beginning of the month and you may find that you have another period at the end of the month. Or even people who are on, cycles that are 28 days, which is their average, they may in some months have two periods in a month, because there's some months which are 30 days and some months which are 31 days. How much blood do you lose on your period? Now, I know it seems like a lot of blood, but on average, people lose about 30 to 40 mils of blood. So that's about 6 to 8 teaspoons of blood. That's throughout your period. So that doesn't seem as much when you think about it, but there are some people who that's the average. So there are some people who will lose a little bit more than that. And we tend to say if you're bleeding more than 80 mils, then that is a heavy bleed. But generally speaking, again, that's really hard to calculate. So I would say if you feel like your periods are heavy, then that's a sign to speak to your healthcare provider about it, so that we can try and establish, are they heavy? And if they are, what do we need to do about it? Alright, so that's some of the commonly asked questions in relation to periods. I hope that was useful for you. Thank you so much for watching this video, and if you haven't joined the Life As community, please make sure that you subscribe to this channel. As a disclaimer, these videos are intended for educational purposes only and not to substitute any medical advice.